Okay, we're going to do the trauma patient assessment for the National Registry. So we get called to motor vehicle crash with ejection, one vehicle rollover, one patient. So I got my BSI on, I'm checking for scene safety and hazards. I don't see any. I've identified I have one patient and my mechanism is a rollover with ejection. So I'm going to have a partner hold C-spine at this time. Now I'm going to start my primary survey. I'm going to look at my general impression. It doesn't look good. Poor general impression because he's not waking up. Now I'm going to assess his level of consciousness. Sir, are you okay? No response. Painful stimuli. He kind of moans a little bit, and that's a 2 on the Glasgow there. So no eye opening, just moaning, incomprehensible as a 2, and then no motor response, so that's a 4. Chief complaint is a motor vehicle crash with ejection, so major trauma, and I'm looking for life threats at this time. I don't see any life threats right this very minute. I'm going to open his airway with a jaw thrust and look in for patency, and it is patent, and I'm looking, listening and feeling for breathing, and it looks, he's breathing shallowly at about 8 times a minute. So at this time I'm going to have my partner bag valve mask with 100% oxygen, insert no PA since he is fairly depressed in his level of consciousness. I'm going to check a radial pulse and a carotid pulse at the same time. I have a very weak, rapid carotid with no radial pulse. I'm going to do a blood sweep. And I have a little bit of blood there, so I'm going to manage and have one of my partners manage that. Just hold some pressure right there right now. Okay, so his skin signs are pale, cool, and clammy. And I'm going to start initiating shock management as we go. Right now I'm doing that with oxygen. We're going to cover him up with a blanket when we get to that point and put him in a shock position when we get there. So I'm going to start my rapid trauma assessment. This is not on the skill sheet, but we are going to go ahead and do it. For testing, we will do it as well. So decap BTLS in his face, his skull, deformities, contusions, abrasions, penetrations, punctures, burns, tenderness, laceration, swelling, and crepitus. I have none. He's managing his airway is fine. I'm going to check his decap BTLS and crepitus in his posterior neck. I'm looking for trachea midline. It is midline, jugular venous distension, or flat. So I'm going to have someone get a C-collar. I'm checking for decap BTLS in his chest, decap BTLS in his chest with paradoxical motion. Someone can put on a C-collar now. I'm listening for lung sounds. In and out with the bag valve mask. In and out with the bag valve mask. Okay. So I've checked his chest. I'm looking at his abdomen and stripped him down. It looks like I have an evisceration here. So I'm going to have my partner manage this with a moist dressing with an occlusive over the top. I'm going to look for distension and rigidity, not pressing on the evisceration. I'm checking for decap BTLS in his pelvis, so I'm going to push in on his iliac crest. If I have no crepitus, I'm going to push down, check his pubis symphysis. For decap BTLS, I'm at the femurs and the lower legs. Decap BTLS, femur, lower legs. I'm trying to assess for pulses. Since I don't have radials, I'm probably not going to have just torpedo pulses. Can you push? Feel that? No moaning. Feel that? No moaning. All right, we're checking for decap BTLS on each arm. All right, my rapid trauma assessment. I'm checking for bilateral radials, still none. Squeeze my hands. You feel that? You feel that? Okay. So our board is here. Everything is ready to roll on my heads count with my partner, which are imaginary. We're going to roll on the heads count, and I'm going to check decap BTLS on his back. Posterior, decap BTLS on his back and buttocks. I don't see any injuries. Rolling back on heads count, 1, 2, 3. So I lost his arm. We're going to have to secure him down on the board and get in the back of the ambulance. where I'm going to perform my secondary exam. We're going to start with a sample history. He's unable to, so I'm hopefully going to be able to get that from some bystanders or anybody that was involved in the accident. Get a complete set of vitals now, have my partner get a blood pressure, pulse rate, respiratory rate, SpO2, blood glucose, and put him on the EKG if we have that option. So now I'm going to do a complete secondary exam. This will be a more slower, methodical exam. So I'm checking the head for decap VTLS, skull, facial bones. I don't have anything different. I'm looking for ecchymosis behind the ears and CSF and blood from the ears, as well as the mouth, head, nose. Looking for ecchymosis around his eyes. Checking for pearl, equal, round, reactive to light at the same round. All right, I've already checked the posterior neck, so I'm going to recheck anterior neck for tracheal deviation and jugular venous distension, and any changes there are none. Checking again for decap VTLS in his chest, paradoxical motion, and then decap VTLS. I'm going to auscultate. All right, in and out with the breathing. All right, no changes, this is bilateral equal. I'm looking at more rigidity distension if we have any. I'm gonna repalpate and just make sure that that is managed. So in decap VTLS on the iliac crest, pubis symphysis, I'm going to inspect the genitalia, checking for decap VTLS in his lower legs, checking for pulses. I have none. Go ahead and see if he can push. Do you feel that? Do you feel that? I do have a wound here that needs to be bandaged. One of my partners is going to do that. All right. Decap VTLS in his arms, checking for radials. And can you squeeze my fingers? You feel this? You feel that? I've already checked his posterior. I've completed my secondary exam at this time. I'm going to do a reassessment survey every 5 minutes, recheck level of consciousness, airway, breathing, circulation, skin size, complete set of vitals, and recheck all of our interventions. So shock management will have included blanket, keep him warm, maintain temperature, raise his feet, maintain the oxygenation on him and ventilation, and hopefully rendezvous with ALS. So there we go.